Good day, agri students. I welcome you
Good day,
to
every student.
another
I welcome
day
you
of
to
this
another
facilitation.
day
Yes,
of
we
this
have gone
facilitation.
6 weeks
Yes,
now into
we
this
have gone
facilitation.
6
Today
weeks
is the
now into
seventh
this
week. Of
facilitation.
course, you
Today
know my name.
is
If you
the
don't know,
seventh week.
I am
Of
Dr.
course, you know my
Abayomi
name.
Bankole. Yes, I
I
have
am
been your
Dr. Abayomi Samuel Bankole.
facilitator
Yes, I
for
have been
this
your
particular course,
facilitator
ANP506,
for
Animal
this
Health and
particular
Disease. Oh, we have had
ANP506.
a good journey thus far, and I know you have enjoyed the journey just as I have. Now, let me quickly remind you before I tell you the topic of today. Next week is the very last day, week for this e-facilitation. So please, we will be doing revision. We'll be doing revisions. And I want to prepare. So please read through all that we have done for the last 6 weeks, including today means the seventh week. We are going to look at something interesting next week. So we are doing revision. Now, what is today's topic? We are going to be considering treatments of livestock diseases in our animals. Yes, treatment of livestock diseases. That's what we'll be considering today. It shall be interesting as always. I can't even wait to go into the class. And of course, under this topic, we'll be looking at different routes of administration of veterinary drugs, and also we'll be looking at generally the orthodox medicine as against the ethno veterinary practice. All right, shall be very interesting. So I welcome you on board. Let us go to class. Let us go to class.
Welcome you on board. Let us go to class. Let us go to class.
Yes. You are welcome to class. You are welcome to class. Yes, the topic, as I mentioned, is the treatment of livestock diseases. Treatment of livestock diseases. Yes, you can see this picture right there on the left of your screen, showing the different drug preparations in veterinary medicine. Yes, see that of injection, see tablets, you see capsules, you can see some suspension there, and some uh, other ones. These are part of what we shall be considering today. So let's go straight forward. Yes, to introduce this topic, before you talk of treating sick animals, you want to carry out a diagnosis. That is to discover what you have to treat. You can't treat what you don't know. Of course, you will not treat what you don't know. So you want to ensure you are doing a diagnosis, confirm uh, the cause of the disease, then you know what you will use to treat the animal. Now, treatment uh, can be the application of drugs or biological substance and or surgical intervention to prevent or ameliorate a specific ailment or condition. Now, when treatment is required, care should be taken to select the appropriate drug, the dose, the frequency of administration, the route of administration, and you also need to get the form in which the drug uh, must be used in order to achieve the desired results. Now, the choice of treatment, especially for food animals like ruminants, should take into account public health, environmental, or regulatory concerns. Very important. Now, treatment is done usually using orthodox, conventional drugs, and in some cases, indigenous knowledge based practices known as the ethno veterinary medicine or practice. Uh, Now, let's start with the routes of drug administration in animals. Routes of drug administration in animals. Now, there are several routes of drug administration used in the veterinary drug administration. The choice of the route and the technique of administration are usually based on a number of factors, which include the species of animal, physical-chemical properties of the drug, and the disease in question. However, you must always follow the manufacturer's recommendation. Very, very important. That is a drug manufacturer's recommendation. Now, let us take these routes of administration one after the other. Here we have the oral route, the oral route. Now, this is drug administration through the oral cavity or the mouth, as we call it. And it's a natural route for drug administration. Just the most common route. Might not be most preferred, but the most common. Now, this is suitable for drugs like antidiarrheals, antiemetics, and supplements, and so on and so forth. Now, when using this route, they must be taken to avoid drugs getting into the trachea. Yes, don't get it into your nose. Of course, you don't want to get it into the nose of the animal, so care has to be taken. Our animals agitate while we try to give oral drugs, even any drugs, through any route for that matter. So we have proper restraint, which have been seen in diagram showing demonstration of some of the routes of administration of these drugs. Now, drug administered through this route are, however, exposed to the action of digestive enzymes and microorganisms that inhabit the digestive tract, which may slow down the drug activity. Now, also, the onset of drug action may also be slower when compared to other routes I just mentioned, slowing down. Yes, it's common with oral drugs. Now, drug administration in feed and water is usually always through the oral route as well. Now, drug formulations or preparations administered using this route of administration include tablets, boluses, suspensions, syrups, and the like. Now, this is a demonstration of applying oral treatment to a carton. You can see that proper restraint right there. Yes, you see, it's only the head of the animal that is allowed to come out. So the animal does not have much space to agitate or to struggle. And so you can see the position of that man right there. Well, this is usually done by a professional. So you have to be well trained for you to do things like this. Otherwise, you may suffocate that animal by passing the drug to a wrong place. That can be the nose, can be the trachea. The animal will just collapse or begin to just go off. Now, another route of drug administration is parenteral route. The parenteral route. Now, this route of drug administration involves using a hypodermic needle and syringe to introduce the medication between the skin and the enteric canal. Now, the drug formulation or preparation is usually a stable aqueous solution or sometimes in oil-based when delayed and prolonged drug absorption is desired. Now, the most frequently used parenteral routes are intramuscular, intravenous, and the subcutaneous routes. Other less frequently used parenteral routes are intraperitoneal, intrathoracic, intracardiac, intradermal, and the epidural route. Yes, let us look at the demonstration of major routes of parenteral administration. Yes, here is the diagram, different diagram, three of them showing the demonstration. Now, you can see the first one there, the intravenous administration. There is something like a drip, we call it drip. Nigeria here, drip. are suspended up there, and obviously there is this uh, uh, thing passed into the vein. So that is how this route of administration is done, right? It is carried out. So intravenously, of course, you find the vein. When you say intravenously, that's into the vein. You want to pass the drug straight into the vein. This is usually commonly used when there is a critical condition uh, of the animal. Maybe seriously affected, the animal is weak, cannot even eat, and all of that. So you want to quickly pass drugs into the vein for faster action. For intramuscular, you can see the demonstration right there. Yes, that is true. Straight into the muscle. That's what we call intramuscular. So we want to pass the drug straight there. And finally, the last diagram right there is the subcutaneous drug administration, and you can see that person pulling up the skin, pass the drug under the skin. That's what we call subcutaneous, under the skin. So that is that. But this is usually done by a professional, so that you don't get the drug into the wrong place, because veterinarians are the professional who do this. Another route of drug administration is topical. Topical on top. Topical route. Topical route of drug administration simply describes application of drugs locally to the skin and its adnexia, or to any of the mucous membranes. And also included in this route are intrauterine, intravaginal, ocular, rectal, prepucial, sublingual, and intranasal. Now, the topical drug preparations include ointments, creams, pastes, dusty powders, lotions, and sprays. So this is a demonstration of the topical drug application. Most of the time, the hair covering the affected portion of the skin is scraped, so that the drug application can be direct on the affected surface. So you don't want to just be rubbing it on the hair without getting where the drug needs to act. And the example of ailment that you can treat this way is mange. That's quite common in cattle and other animals. Yes, another route of drug administration is the pulmonary route. So this is by inhalation. Now, this route of drug administration uh, is common in when you are applying drugs in a gaseous state or volatile agents. Now, drugs here are absorbed rapidly from the airways and their alveoli into the pulmonary circulation. Now, they are usually applied using a nebulizer or by standard anesthetic machines. Now, let us look at veterinary preparations. Now, pharmaceutical preparations intended for use in animals usually come in different forms depending on the species of animals and the disease for which the preparation is targeted towards. The various forms in which these preparations come include, but not limited, to tablets, capsules, creams, emulsions, ointments, injections, powders, gels, sprays, boluses, and drops. Now, for the desired effect to be obtained, the drug must be administered using the appropriate route, and this must also be in accordance with the manufacturer's recommendation. Now, the classes, let's look at classes of selected veterinary drugs. Classes of selected veterinary drugs. Veterinary drugs are actually classified based on the organism on which the drug acts, or the organ of the body where the drug action is desired. Now, for the purpose of this class, we'll be looking at drugs classification, veterinary drug classification based on the disease causing agent or etiology. And this is it here, drug classification based on the etiology with examples of those drugs. We start with antibacterial. An example include oxytetracycline. Of course, we hear oxytetracycline. It's also used in animals, just like it is used in human beings. Streptomycin and penicillin, these are antibacterial drugs. Yes, because they treat bacterial infections. Number 2 here is antiprotozoans. Examples include imnacin acetate, amprolium, and medium bromide. Yes, number 3, anthelmintics. Anthelmintics example include levamisole, albendazole, parental palmate. Number 4, antifungals. Examples include ketoconazole, isoflurane, and nystatin. Yes. These are examples for antifungals. Number 5, antidiarrheals, and they include metoclopramide, diphenhydramine, and calpeptide. These are antidiarrheals. And lastly here is anti-inflammatory or analgesics. Examples include dexamethasone, vinylbutazone, and acetyl salicylate. Let us go straight to ethno-veterinary medicine or practices. Now, pastoralists or other livestock farmers in Nigeria, like their counterparts in Africa and in the world at large, have always relied on locally available plants and herbal preparations for animal treatment before the advent of Western veterinary medicine. Now, this indigenous knowledge is often referred to as ethno-veterinary medicine or practice. Now, ethno-veterinary medicine includes indigenous beliefs, knowledge, skills, methods, and practices that are pertained to the health care of animals. It's largely used effectively by local farmers for keeping animals healthy and productive. Some advantages of ethno-veterinary medicine is that it's cheaper. It's based on local resources. However, some difficulties associated with veterinary medicine include lack of proper documentation and validation, difficulty in standardization, and non-availability of plant parts all year round. These are part of the major problem. That's why I find orthodox veterinary medicine more appropriate. The same thing applies in human medicine. Now, the use of several medical plants in the treatment of animals have quite been documented, but the absence of standard dosages and preparations hampers their inclusion in normal animal healthcare delivery systems. Yeah, in comparison now, let's look at ethno-veterinary medicine and orthodox veterinary medicine. Ethno-veterinary medicine, number 1, is indigenous and it is evolved by farmer and it is farmer oriented. While for orthodox veterinary medicine, it is developed by researchers and it is science-based. Number 2, it is passed on from generation to generation or from farmer to farmer under the ethno-veterinary medicine, while it is communicated from researchers to veterinarians under the orthodox veterinary medicine. Number 3, for the ethno-veterinary medicine, it is compatible with local situation and low dependency on external inputs, while for the orthodox veterinary medicine, it may or may not be compatible with local situation. and it's more dependent on external inputs. Number 4, for the veterinary medicine, it's not well researched. Like we said earlier, not well documented. While for orthodox veterinary medicine, it's very well researched, well documented. Number 5, for veterinary medicine, it takes longer to show effects. While for orthodox veterinary medicine, the effects or results are quicker. And lastly, for the veterinary medicine, number 6, usually specific to local situation, since it is dependent on locally available inputs. But for the orthodox veterinary medicine, general recommendation is not tied to any locality. Now, in summary, what have we done today? In today's class, we have been able to examine that 1, the routes used for drug administration in animals are oral, parenteral, topical, and pulmonary. 2, we have seen that veterinary drugs come in different forms or preparations, namely tablets, capsules, creams, emulsions, ointments, injections, powders, gels, sprays, boluses, and drops. Number 3, we have also seen that veterinary drugs are classified as antibacterial, antiprotozoans, antifungal, antiemetic, antidiarrheal, and anti-inflammatory or analgesic agents. And lastly, we have observed and we have studied veterinary medicine, and we have seen that it is essentially indigenous knowledge of animal health care by local farmers, and we compared this practice with the orthodox veterinary medicine. Oh yes, this is where we will be stopping today. Like I told you earlier, please, next week is the final week for this facilitation, and we will be expecting a revision. Yes, I told you it will be for revision. So please go through all that you have been taught all these 7 weeks, and it shall be very interesting as always. And of course, please always visit the virtual learning environment. Interesting things are happening there. All right. So from me to you, from here, I say bye bye. Bye bye.